Welcome, everybody. I am here today with Megan, who is a graduate of Concordia St. Paul. She's going to introduce herself, talk a little bit about her current career, and how her education at Concordia got her where she is today. Welcome, Megan.
Thank you so much, Jen. Yeah, so I'm Megan. I came into Concordia in 2018 as a biology major, knowing I wanted to pursue something in healthcare, but not exactly sure what. I played on the women's basketball team here for 4 years, which was a great part of my college experience. During my freshman and sophomore years, I started networking and learning more about kind of what I was wanting to do. Um, Within my profession. I didn't really go in thinking I wanted to do nutrition, but I started making connections and eventually I decided that I kind of wanted to go the nutrition route and become a registered dietitian. I made a connection with one person that I knew pretty well, and she was in the process of becoming one. So I really leaned on her for some more insight, and that's really how I decided to go towards dietetics. The challenge at that point in my sophomore year, I think it was that Concordia did not have a nutrition major, which means they did not have DPDs, which is called the Didactic Program in Dietetics, which is a requirement to sit for your RD exam. I was also in the situation where I didn't really want to transfer because I loved playing basketball at Concordia. So I decided that in order to apply for my master's program, I was going to make sure I was meeting all the prerequisites to become a dietitian um, without those DPDs. But then I realized as I did some research that some master's programs allowed you to do your DPDs with your master's. So you kind of met both requirements at once. So I decided to do that. And that's where I um, landed to go to the University of Wisconsin Stout for my master's. So I was able to do my master's and my DPDs all at once there. And before like getting into graduate school, while I was at Concordia, I was making sure I was hitting all my science courses. There were a lot of science courses within the exercise science major that weren't required, but I did need in order to go into my master's. So a lot of those were like the biochemistries, the microbiology, organic chemistry, anatomy and phys, chemistry. So I made sure with my advisor that I was hitting all of those. But yeah, so then graduate school is really exciting for me because it was the first time I was surrounded by people passionate about the same field. As I started my master's program, I was also interning with Go for Football as a sports nutrition intern. I have always loved the sports and really enjoyed my time getting experience sports world in dietetics. I have a passion for sports nutrition and the impact it has on performance of athletes. My coursework in my master's program included like medical nutrition therapy, research in nutrition dietetics, advanced nutrition, education, counseling, food science, and community nutrition. And I also did a thesis project where I evaluated eating disorders among college students, and that really deepened my interest in that niche of dietetics.
Mhm.
During my master's program, that's when I started to apply for my dietetic internship, which is the last requirement to become a dietitian. And I was thrilled to be accepted into my top choice, which was the University of Minnesota's eating disorder concentration. So on that side of the concentration, we get a lot of work in eating disorders, but at the Emily program. So I got extensive experience at the Emily program working across residential, PHP, and outpatient settings. And my internship also included rotations in private practice, dialysis, food service, and clinical nutrition, where I was at Hennepin County Medical Center. At the end of my internship, I finished in May of this year, 2025. I got offered a position at HCMC to be a clinical dietitian, and I've been working there ever since. I officially became a registered dietitian in June of 2025 after passing my RD exam on the first try. So yeah, in short, like the path to become it includes your undergrad and then a master's and a dietetic internship, and then you eventually can sit for your exam.
Perfect. And people who are watching this who may um, not be familiar with all the nomenclature and words, because those things get tossed around a lot between the difference, nutritionist or registered dietitian or dietitian or nutrition specialist or all those words. And especially with social media now, people call themselves nutritionists and they aren't really. So
Right.
can you talk about some of the differences between how those words maybe get used interchangeably but aren't necessarily the same?
Yeah, so it is a big thing with social media nowadays, but I'll say registered dietitians, in order to have that credential, you really have to go through the schooling of an accredited program. So you have to have your undergrad in nutrition or get your DPD verification. You have to do a master's program. And you have to complete that accredited dietetic internship, which is usually like a 10 to 12 month clinical
Okay.
rotations. Whereas, yeah, like people that might consider themselves nutritionists, sometimes like you, nobody, not everybody can be a dietitian, but anybody can really call themselves a nutritionist in a way. So it's like a nutritionist really isn't credentialed, and you could really take a couple nutrition courses or do some research online and really just call yourself a nutritionist, whereas a dietitian has to have the credentials to do so and really pass that RD exam. So,
Yeah, perfect. Thank you. That helps for clarity. And
yeah.
you mentioned a lot of experiences that you have. People will specialize in sports or eating disorders or clinical populations or special populations. So really the world of dietetics is really wide open. What are some of maybe the not glamorous or everybody thinks I want to create meal plans for Olympic athletes, but that's not everybody. Like there's food service, school wise, like government wise, like what are some of those other jobs that people maybe wouldn't put two and two together with that involve nutrition?
Yeah, I think that like nutrition is such a diverse field and there are so many career paths beyond really what people see. And I think even for me going into it, I thought I had saw like a lot of the careers are clinical dietitian. You're working in a hospital, you're doing basically that, but there is so much more that I think a lot of people don't know. And even me going in, I didn't even know.
Mm-hmm.
Um, I'll say so like you kind of touch base like on schools. I think that that's one. So like community nutrition or food service there are jobs within school districts or universities where you're really working more so on yeah like food service things. So you're in food service, you're meal planning, you're doing like that type of stuff that are making sure you're hitting like the government
Mm-hmm.
requirements in terms of nutrition. Or you can focus on like childhood nutrition programs, food insecurity initiatives, chronic disease prevention campaigns. There's some others like private practice, I think really allows dietitians to go into what their niche is. When I interned with some private practices, both of their niches were sports nutrition and eating disorder, so it was a combination. And I kind of picked to go that route because I wanted more experience there. But there's so many other opportunities like oncology dietitians, diabetes educators, dialysis dietitians, media and communications. There's a lot of things going online now where people are able to use social media to really grow their platform and their business within nutrition. So yeah, there's so many different areas you can go into.
Yeah, which can be exciting for somebody who has a passion for nutrition, but maybe doesn't see themselves working one-on-one with
Right.
clients in a private practice, but still want to put some of those skills to use.
Yeah. Yeah.
So speaking of that, tell us what a typical day is like for you or with your official job title right now. What does a week look like? Are there different cycles that kind of go through the year? I know you haven't been there that long, but what are some of the things that if somebody were going to go into something like this, they could expect their work day to look like?
Yeah, so right now I am working as a clinical dietitian. So I'll just speak from that point of view, but as a clinical dietitian, my day is a mix of patient care, documentation, and collaboration with the healthcare team. So usually I start in the day, we get there, we do all of our we like go through our follow-ups for the day and any new consults we got from physicians. And then we have a morning meeting, chat about who we're seeing, how many patients we're seeing that day. And then really it's just reviewing charts and you can kind of split. I'm speaking for HTMC, how we do it. We can split our day up however we want, as long as we see the people we're supposed to. And as long as we're staying on top of if there's consults throughout the day, we have to pick them up and go see them as well. But really, I like to split my day up as after our morning meeting, I like to do chart review. I go see about half of my patients in the morning, come back, chart, And then we go to lunch. The dietitians, we eat lunch together. We go for a walk usually after lunch just to get outside and get moving. And then I'll go and chart review the next set of patients and then go see them and then chart on them in the afternoon. I like to break mine up so I can go out and like get out, chart, get out,
Yeah.
not sit at my desk for too long a period of times. But that's really how the day goes. And I will say that the rhythm is a balance between patient interaction and then behind the scenes planning, but every day is so different in like who you're seeing.
Mhm.
So I do really like that variety in it. But yeah.
Yeah, it's like a little puzzle, right? Because human beings are, everybody has their own specific needs, and you're getting to kind of, yeah, figure out what's going to work best for them and keep them healthy as well.
Yeah.
Yeah, totally. Would you say that, because you said you all eat lunch together and then go for a walk, and I get this when I tell people that I'm a exercise and fitness professional, they'll be like, well, I had a donut today, or like, oh, I didn't walk today, and they feel like they need to unburden themselves or like apologize for their behaviors. Somebody does not have to be a perfectly clean eater to be interested in nutrition and dietetics, right? So you don't,
Yeah.
yes, you should understand it, but talk a little bit more about maybe the feelings behind, like, you're still a human being and you enjoy foods and enjoy doing different activities, and like how do you find that works in with your job?
Yeah. So I feel like my personal nutrition philosophy is that all foods fit. I, I feel like there's a lot of misconceptions about how you are supposed to fuel yourself and that you have to eat clean. You have to, and like I'm putting quotations on clean because it's like really you can still fuel your bodies while eating what you crave. And I think suppressing your cravings is only going to make you crave things more. And I believe that all foods can fit into a healthy lifestyle.
Mhm.
And I really think like addition over restriction. Being somebody that is very, very interested in the eating disorder side of things, I just stand for all foods fit, and I don't think that you should be feeling bad about yourself for the things you eat, and that you can have balance while also going into your cravings.
Yeah, perfect. So for any students watching this, you do not have to be nobody's going to be perfect at anything, and you
No.
can you can fit your lifestyle into that career plan as well.
And I would love to make a note that our office, we have a table that we sit at, and in the middle, like every week, somebody brings treats and things to put in our little jar, and we are constantly grabbing. So yeah, there is no such thing as a perfect diet, and yeah, you should never have to feel like you need to strive for that either.
Right, right. So with the advent and the explosion, I guess, of social media and a lot of conflicting information at our fingertips, um, some food is in and some food is out, and this is how much protein we should have, or genetically modified foods are okay or they're not okay, or we should be doing intermittent fasting, this or that. Number one, how do people sort through all of that? But then number two, so sorting through the bevy of information that's out there. But then number two, where do you see the field of nutrition going, since you've been in the midst of it for the last few years? What other things have we not even thought about yet that are going to be coming up?
Yeah, I feel like the amount of information that is going online, just because social media has grown so much within the past couple of years, I think that it has become a huge way that people, any person, not even a healthcare professional, will share things that might have worked for them. And I
Mhm.
think it's important to know when you do see those things, you might want to be like, oh my God, I need to do exactly what that person was doing because it worked for them and look at the results they had. But I do think that something that works for one person might not work for the next. And I think that that's why nutrition is such an individualized thing that you should be cautious about what you believe on the internet, and really take your information from people that you trust, that you know is spreading the proper information. And I think that if you see something and you're like, wow, like that might be something I want to try, I think really digging in to do more research on it or asking a
Mm.
professional would be very, very beneficial, because I think that that really can kind of, before just jumping on it and being like, I'm buying this supplement or I'm buying into whatever that person's doing, it really helps you see if that's going to be what's beneficial for you or if there's a different route to take.
Mhm.
But with that, I think that there is enormous growth in content creation. And so social media, podcasts, online platforms have given dietitians an opportunity to reach a ton of people
Mhm.
with them being credible, evidence based. So in a world where there is misinformation about nutrition, it's never been more important for credentialed professionals to show up online. And I think that dietitians can really use platforms not only to debunk things that are being shared, but also just make science accessible, relatable, and actionable to everyday people. And I do think the next generation of RDs are leaning on this more and more, whether through it's their personal brands, collaborations with healthcare organizations, or just innovative forms that are like digital education that people can download.
Yeah, yeah. Good. So always more to come and it's evolving as we
Yes.
learn more about just the science, yeah, the science behind food as well.
Yeah.
So let's shift gears a little bit. So if people are watching this and they're like, that sounds exciting. I am interested in something that doing something like what Megan's doing.
Yeah.
What do you feel like as your 19 or 20-year-old self you wish somebody would have told you or you learned after the fact?
Yeah. So as a student, I kind of wish I did have a clear roadmap for navigating the dietetics profession. Coming from a school without a nutrition major, I didn't have much guidance, so I had to seek out my own resources to figure out the right path. This was a huge growing point for me as I was really required to navigate this journey and find the right opportunities. I didn't fully understand all the steps required to become a dietitian when I had decided, um, like how to plan for internships, what experiences would make me a competitive candidate,
Hmm.
or even like which resources were out there that could support me on that journey. I really had no idea. I didn't know any of it. And so looking back, I realized how valuable it would have been to know early on about networking, joining organizations like the Academy of Nutrition and Dietetics, and getting involved in volunteering or like shadowing experiences. Um, those connections and hands-on opportunities are what really do set you up to kind of know more about the profession.
Hmm.
It wasn't until I did enter my master's program that I truly gained a clearer picture of the dietetics field. I was I just was in a setting where people were the nutrition major, so everybody knew everything. And I kind of went in and I'm like, I knew some things, but like I learned a lot. It was a huge growing opportunity for me. And it was honestly where I fell in love with nutrition because I felt like I was with like people that were doing the same thing as me every day. Um, but yeah, so I feel like it was just so hard not knowing going in. And then once I really was around people that were the same as me that were going into nutrition, I feel like that was where I was like, wow, there is so much more to nutrition and I'm learning as I go. So
Hmm. What would be, do you have one or two websites or magazines or podcasts or associations off the top of your head that you'd recommend for students to follow or join as a student member or subscribe to a journal or what might be a couple of starting steps for them?
yeah, I have a whole list that I can also send to you and we can add, but um the first would be the Academy of Nutrition and Dietetics. So you can become a student member. Otherwise you can go on there and it has like info for students and RDs that you can just look over to without being a member. So that would be the website is eatright.org. And then the other one would be um, ACEND, which me and you chatted about one time, but it's eatrightpro.org/ascend. And that one lists all accredited programs. So if you are trying to go, if you're in your undergrad and you are trying to look at master's programs and internships, it lists all programs across the country that are offered that are accredited. So it would be smart to look at that just to make sure you are applying to accredited programs because there are some out there that aren't accredited. So you really wouldn't be able to sit for your exam by completing those. And then you can also go to the Commission of Dietetic Registration, which is cdrnet.org. And that just talks about like credentialing and exam requirements. I didn't really go into that one until I was really like in my master's,
Hmm.
like deep in my master's, because it wasn't really any benefit. There wasn't
Hmm.
really a benefit for me right and then because I wasn't close to taking my exam. But yeah, those I think are big three ones. Those are the big three that I would recommend right away.
Perfect. That's very helpful for all of them. And yes, we will link them in the
Yeah.
show notes.
Yes.
Megan, is there anything else that you want to say to students that you want them to know? Something that you've discovered about yourself since you've exited your undergrad career and now become a young professional? Just anything else, school related wise, personal, professional, that you think would be helpful for students who are considering this career path to think about?
Yeah. I will say, going into it, I really did have my niche, I say, is really like what I wanted to go into, which was working with eating disorders or sports. And um, going into this field without, I did have really good connections when I went into it, but I think that I really, really wanted those two side of things. And I was kind of like, I don't think I'd ever want to be a clinical dietitian. But as I went into my internship, I went in with an open mind on every single rotation. And I didn't have a single rotation I didn't like. And so I feel like that really opened up the opportunity for me to go really into any area of dietetics and be happy about it.
Mhm.
I didn't think as a sophomore in my undergrad that I would be a clinical dietitian, but I currently am, and I actually really, really enjoy clinical dietetics. I don't know if I'll be here long term, as I do still really love the side of eating disorder and sports, but I am really happy with where I'm at right now, and I love it. And so I feel like going in with the open mind into all the experiences I did, it really allowed me to see different areas and realize like it's not what I thought it was. And I really just got to experience something different that I ended up liking overall. I'll also say networking early is super important. I did network and like I mean, my parents were both on the business side of things, and so they had connections in business, but they didn't really know anybody in the dietetics field. So it was like I'm really on my own to try to do this and find people and learn more. And so I utilized LinkedIn. I utilized people I knew in the healthcare industry that might have known dietitians. So I think it's very important to use LinkedIn, and I'm so happy that I was able to get that information going into college about starting a LinkedIn profile. But also I'm always available if anybody ever had questions. They can message me on LinkedIn, they can email me. I have a nutrition Instagram. So if they ever wanted to DM me, they can DM me. But yeah, I do think it's so nice to be able to talk to people about it because you do get to learn a lot more when you're around people that are knee deep in it really.
Right, right. And now you are paying it forward, right? You were that student who didn't know much, and now you've learned and you want to be able to share your experiences so our
Yeah.
students can have a positive experience.
Yes.
Great. Well, thanks a lot, Megan. This will be very helpful for our students. We appreciate you taking your time today.
Yes. Thank you so much, Jen.
Of course. Take care.
Yep. Bye.